Prairie Ridge has offered hope and healing to the people of north central Iowa for over 40 years, providing comprehensive, patient-centered treatment and prevention services. Each person who walks through their door is treated with dignity, respect, and a commitment to help improve their life.
For many years, care has been provided in silos, so substance use disorders in one spot, mental health care, and others medical care at other places. So we have endeavored to integrate care here at Prairie Ridge so that when people come with a variety of problems, comorbidities, we will be able to provide their substance use care, mental health care, as well as primary care. So I think we're able to meet people's needs as they come in more holistically, and if they have a health problem, we can hook them up with our provider. A mental health issue, they can see a psychiatrist or ARNP, and obviously then also receive substance use disorder care. I'm very proud that every person that walks in our doors or that we come in contact with is treated with dignity and respect. It's certainly a key, and I think the thing that I'm most proud of at Prairie Ridge is that I'm assured every day that people who come here are treated with care and dignity and will leave our doors feeling that they are cared for as a person. The relationship that we have with our patients is paramount throughout our organization, and I think really defines our organization.
The culture of Prairie Ridge is one of empathy and understanding and compassion for both patients and with staff. Our number one goal here is to have a healthy person leaving here, and when that patient can't quite see that, that's okay, because we meet them right where they're at in that time in their life. I've worked with many counselors, and when I see a patient leave the counselor's office with a sense of purpose, I know that they are getting what they need. There's a quote by John Gordon: "There's nothing more powerful than a humble person with a servant's heart and a warrior spirit who is driven by a bigger purpose."
I started coming to Prairie Ridge in like 1999. I came in here to help deal with an addiction, drug and alcohol addiction, and I made it through the program, and I went on and I did good for a while, and then I relapsed because I came in here not for just me. I came in here because I was made to come in here at first, and it didn't work out so well. I just don't think that I gave it my all. I wasn't ready, you know. And so then I went to prison and I did a lot of time. Then when I came back out, I promised myself I'd work somewhere for a whole year. So I went to Hardee's and worked there for a whole year. And then I heard that there was a CA job opening up out here at Prairie Ridge, and that if you have like addiction issues or past addiction issues, that you could apply for it because they want people with experience to help the clients. I help like teach class, I distribute medication, I make sure that they're actively going to participate in all the programs that we offer. My recovery process is been tremendously impacted by Prairie Ridge. I never felt like I wasn't treated like a human here. Like there was times where I felt like life wasn't worth living, and they never let me believe that I was just not worth it. They always said things to me like I'm lovable, and things like they trust me. Like I came in here and it's trust first. You have to break the trust before they give you everything that they have, and they don't give up on you. So if you want help, this is the place to be. If you're obviously seeking help, you need help, because you don't just have issues that just go away. They build and they build. So you can come here and you can get help in all different areas. You can get mental health help, drug addiction help. We pretty much focus on like, you know, all the issues that you could possibly have, and we don't just deal with one. We help you through all of them. So it's a good place to come for that.
Treating substance use disorders has changed a lot over the years, specifically even just with the language that we use. And so we've switched from addiction or substance abuse to referring to substance use disorders. We've also, as we've moved further into healthcare, switched from referring to the people that we serve, our consumers, from clients as patients. As they're referred to in every other healthcare field. And we've also moved to using highly trained professionals and evidence-based programs and practices in the work that we do. It's really important that we know what we're doing works. And so by using evidence-based programs and practices, research has already been done on the practices so that we know that they have a positive impact on the patient, so that we know that the patients are better with those programs, or their treatment experience will be better than using maybe other practices that are out there where research hasn't been completed on them. We have to understand that the people that we serve, their life doesn't end as they walk out the door. They have many different agencies that they come into contact with, and so we need to make sure that all of our services are aligned in order to best serve the patients and the other consumers that we serve. I think we do good work, and I think our patients agree.
For more information about the services offered at Prairie Ridge, as well as their history, mission, and vision, log on to prairieridge.net.